I'd like to talk to you about a surgery for breast cancer that's called breast conserving surgery that will allow you to conserve your breasts. I would like to talk to you about the journey or the history of the breast surgery. And right after me, we have Professor Sung-Pil Chung, who will be sharing with you a very interesting historical background on the development of breast cancer treatment. So I'll be very brief. So this is the origins of the surgical procedure in breast cancer. It goes back to in 1994 with William Halsted, who introduced the radical mastectomy for breast cancer for the first time. So back then in 1994, the breast was removed, as you can see, very extensively, and people thought that this was very helpful for the treatment of breast cancer. So if you look at this picture, it's back then, with the skin, all breast tissue, and the muscles were all removed. So it was a very extensive surgery performed on the patient. So as you can see on the left-hand side of this person's body, all of the tissue, the skin, were gone. And so from a morphological point of view, it was very difficult for the patient to bear. And it was very difficult for the patient to raise her arm. And also it was accompanied by edema. And so there has been a lot of developments to overcome this. And Professor Chung will give you more details about how we developed. And so the radical mastectomy has evolved into breast surgical procedure called modified radical mastectomy that allowed you to remove a smaller portion of the affected area. So this is something that is also extensively used nowadays, and so this is the final result of the procedure. And with time, can we find a way to preserve the morphology or the form of the breast in a breast cancer patient? So if you look at the breast, compared to males, breasts are very much developed in order to allow for breastfeeding. But this is not an organ just to allow you to go through breastfeeding. But the breast itself is a very important organ for females. So you would like to preserve as much as possible the breast, and also to get rid of the tumor as much as possible. And we'll come back to this later on. While preserving the form of the breast, we're trying to eradicate the cancer or the tumor. So this is a view of the breast. And so the mammary lobule or the mammary duct or the lactiferous duct are present in the breast to allow for breastfeeding. And so that's where cancer can occur. So the yellow part is the fat layer, but in the fat layer, usually the cancers do not occur. So if you just take out that area affected by the cancer, for instance, the incision site will be on the upper part of the breast, and removing the affected area, the lump in the surrounding tissues were removed to remove the breast lump. And so this is an actual patient of mine who had underwent the surgery. So it's very difficult for you to see which part of the breast, the left or right, underwent surgery. It's if you look at the closer look, it's the left side. So in breast conserving surgery, for us, the objective is to maintain as much as possible the symmetry of the both breasts, even if it's not 100% satisfactory. And so this is the different types of attempts. Not only surgery, but also medication. For instance, some patients say come to see us and say that, can I just take my medication for 2 years or 5 years and not for a lifelong? So It's like a recipe from your grandmother. So depending on what your doctors say, it's not just what your doctor is saying. It's according to the results that are the findings of these clinical trials. So only when we have validated results from such a clinical trials would we adopt such strategies. And I would like to present it to you two major studies revolving around the breast cancer, and they are monumental. And for 20 years, patients were followed up for 20 years to look at recurrence, at survival. According to different surgical modalities, these studies look at different aspects of the breast cancer. So this is a total mastectomy, and in this case, the removal of the lump or lumpectomy alone. And in the third group, we look at a group that underwent a lumpectomy plus irradiation or radiation therapy. And these are the number of patients that were enrolled in each of the groups, and they were well balanced. And if you look at the total mastectomy group alone compared to the lumpectomy plus irradiation, the recurrence rate was higher. So among our audience, if you have gone through breast conserving surgery after BCS, you have all gone through irradiation. So compared to the total mastectomy alone or the lumpectomy alone, the lumpectomy plus irradiation group fared better. So I'll come back to this point later on. But for 15 years back, it was very different from what we're doing today, because back 15 years back, we tended to go for mastectomy rather than lumpectomy alone, even if we were able to conserve the form of the breast. But with medical development, the development in medicine, a lot has been achieved in preserving the breasts. And as you can see here, the recurrence rate or the metastasis to the contralateral breast in the total mastectomy, compared to the total mastectomy group, the lumpectomy plus irradiation group does not fall behind the results of the total mastectomy group. And after that, a lot of subsequent studies were carried out, and in one European group, there were 17 such clinical trials, and this is a meta-analysis of these 17 randomized trials. And like the results that we saw through the first clinical trial, the lumpectomy plus irradiation group compared to the other groups showed better results in terms of recurrence or breast cancer death or any death. All of these groups show that irradiation, additional irradiation to surgery, was beneficial to most of the patients. And this may be a very provocative story, but if you look at the death related to breast cancer, of course, this has to do with the recurrence rate, because if the recurrence rate is higher, we can assume that the death-related breast cancer will go up. If you add irradiation to these groups, you can see that the treatment results were better in those groups. And if you have breast cancer, the first thing that you would look for is axillary lymph nodes. And if there is a metastasis in that area, it shows that this is not early stage cancer. So when there is lymph node metastatic patients alone, irradiation would add beneficial effects to patients after surgery. And this is the National Cancer Institute, or the National Cancer Center of the United States, called NCCN. And the contraindications for breast conserving surgery. We can see that for absolute contraindications, we have a number of items, and also we have relative contraindications that would discourage you from opting for a breast conserving surgery. For absolute contraindications, since you have to go through an irradiation therapy after the surgery, you would readily think about groups that are not able to go through irradiation, such as pregnant women. So if you are affected by breast cancer during pregnancy, it can lead to malformations or deformative birth. So in pregnant women with breast cancer, breast conserving surgery is an absolute contraindication. On the right-hand side of the slide, you can see an image. This is a mammogram during a routine checkup. You can see that there is a hazy area, and this is called microcalcifications of the breast. And so sometimes we explain to our patients that this is really the seed or the seedling of cancer. So we can see that there is a widely distributed microcalcification. So after removing this, the breast would have a major dimple or a deformed because of that, because the local excision area would be very widespread. And usually, the surgeons, after removing the cancer, would check for the margins and to see if they are affected or not, and before concluding a surgery. So when there is a diffusely positive pathological margin, for instance, it is also considered an absolute contraindication. And if you look at relative contraindications, for some reason, if you have a chest or if a breast irradiation history, or if you have disease involving the skin, like scleroderma or lupus, this is a relative contraindication. So this was rather difficult for you to understand maybe, but to simplify the story, the breast conserving surgery allows you to remove the cancer, at the same time allowing you to preserve the form of your breast. So as you can see in this picture, before the surgery through mammogram or MRI or ultrasound, you would go through a number of imaging diagnostics, and the lump and the surrounding area. As you can see, there are seeds surrounding this cancer tumor. And so in younger patients, fibrosis is something that is a benign tumor, so you would just remove the mass. But in cancer patients, there might be these residual seeds, so you do not remove the lump only, but you will have to remove some amount of normal tissue with the tumor. In order to preserve the form, if you remove too little, you would leave behind a number of dangerous or suspicious seeds. And after the surgery, this is bound to recur, so there will be local recurrence. So ideally, with the tumor, you would want to remove a certain amount of normal tissue, at the same time not affecting the form of the breasts that can lead to deformation of the breast. So you don't, compared to the size of the cancer, you don't have to excessively remove the normal tissue. Or if the tumor is big, and if you want to preserve the form of the breast, so if you remove too little, as you can see, compared to the left-hand side and the right-hand side, you can see if you over remove or under remove, these are the anticipated or the expected results. So if you think that something like the right-hand side picture might happen, you would go for a mastectomy instead of a breast conserving surgery. And this is something that we published from the Korea Breast Cancer Site called the White Paper. This is a statistical analysis on a yearly basis. If you look at the early 21st century, this is a stage 0 or the carcinoma in situ. And as you move up the bar, you would move on to stage 1, stage 2, 3, and 4. So you can see that stage 0 and 1 is rising year by year compared to the past. So that means that the early diagnosis of breast cancer is happening. And thanks to that, in red, the curve shows a partial mastectomy, and in blue shows a total mastectomy. So from 2006, there was a crossover between these two modalities of surgery. So the partial mastectomy becoming bigger. Of course, this has to do with the irradiation benefits and also the fact that people are very much interested in their well-being and their health. So even if they're not having any symptoms, they would go for regular checkups. So early diagnosis of breast cancer, the portion of this early diagnosis is on the rise, and this is the result that we can see on these graphs. So when you come to the hospital and sometimes they ask, when do you think this cancer first began? But I tell them that there's no way of really finding out and knowing that. So as you are well aware, breast cancer in advanced stages can be accompanied by symptoms and pain, but usually it's a silent cancer that is not accompanied by any symptoms or pain. So you will have to be more attentive to your health and go for regular health checkups that will allow you to diagnose and detect breast cancer early. So I would like to urge you and recommend that you get regular health checkups. So in the same white paper of Korean breast cancer, so the first row shows the proportion of people who have gone through a breast cancer screening. And B, or the second row, shows people who are compliant to the schedule or the recommendations that are formulated by the National Cancer Screening Program. So as you can see, as time goes by, the portion of people who get regular checkups recommended by the National Cancer Screening Program is rising. So these regular health checkups were instrumental in raising the portion of people who are detected with early cancer rather than late-stage cancer. And so that would allow you to have an increased possibility of having a breast-conserving surgery as compared to others, as opposed to others. So early diagnosis and early treatment is really key in the treatment of breast cancer. And thank you very much for your attention.